would be the best way of eating for swollen legs or swollen feet or really swelling anywhere? To start with, I'm going to quickly explain who I am and why I might know something about swelling. I'm a lymphedema therapist. I've worked with a condition called lymphedema for over 15 years now. And I'm going to explain later in this video what lymphedema is, because to understand swelling, you have to know what the lymphatic system is. So I'm going to try to keep it brief, but so the lymphatic system, it's like a plumbing system of the body, and its job is to move fluid. So if we're going to look at swelling anywhere, the lymphatic system is involved. It's the only part of the system that can move fluid that presents itself as swelling. It's not the blood. It comes from the blood, but it can't go back into the blood. The only way for that swelling to move is through the lymphatic system. So if swelling is chronic, if it's there all the time, most likely it is lymphedema. Either way, it's the lymphatic system that's not keeping up. It's not moving fluid fast enough, no matter what the underlying reason was. So as we go on, I, of course, want to do a disclaimer. I don't know what's causing your swelling if you're watching this video. And so you should consult with your doctor before you make any lifestyle changes. I cannot make any specific recommendations, but I'm going to share a little bit about what recent research have shown, and also what I have seen in the clinic since we've started helping our patients make diet and lifestyle changes. We've been doing that for a couple of years now, and we've seen a lot of improvement with lifestyle changes. So to know what, so I explained a little bit about what lymphedema is. That's fluid not moving through the system fast enough. So the swelling may have been caused by an overload of fluid, or there could be a damage to the lymphatic system. When there's a damage to the lymphatic system, that's called lymphedema. If you have swelling for a long time, the lymphatic system becomes damaged. So now you have lymphedema also. So what is the most common cause for lymphedema? Surgery is one of the reasons, but actually one of the most common contributing factors to lymphedema in America is obesity. It's being overweight. And it's no secret that we have a real problem in America with that for various reasons. So if we're going to help the lymphatic system, we have to address the obesity. So now if we're looking for what is the best way of eating, we have to look for a method that is proven effective and sustainable in reducing overall weight. And we want to find a diet that is not bad for the lymphatic system. And there's actually been trials on this, and there's a lot of emerging research coming, both on animals and humans, and that's really exciting. So the short answer is the most promising diet for lymphedema is the ketogenic diet. And with studies, it often begins with animals and then you go to humans. There were some really exciting studies made on mice, and where they actually did some damage to the lymphatic system in the tail. The tail would swell up. One group, they fed ketones, which is what the body produces when you're on a ketogenic diet. The other group, they fed glucose, which is what the body produces when you eat a standard American diet. We run on glucose. The mice that ate ketones actually developed new lymphatics across the scar. That's amazing, because we didn't hardly even think that was possible. And the existing lymphatic vessels started pumping fluid faster. The control group that ate glucose, their lymphatic system took damage. So now if you were to go on a low fat or low calorie diet where you reduce the fat, you're running off of glucose, which comes from carbohydrates. Even if it's fruits and vegetables, it still turns into glucose and fructose. The lymphatic system could take some damage from that. Then we've learned more about the lymphatic system and learned that the lymphatic system actually is fueled by fats. So if you're on the ketogenic diet, you're eating fats and you're cutting out the glucose, the sugar that can be harmful to the lymphatic system. So the ketogenic diet appears to be the best. So now they took this knowledge and they've done studies on women that have had breast cancer with damaged lymphatic systems, and they're getting good results. They've worked with a condition called lipedema that can be very stubborn and difficult to lose weight. And they're seeing results not only in weight loss, but in reduced pain and discomfort and reduced swelling, reduced need for compression garments. So if you want to know more, I know that was a lot right there, but I'm putting a link in the description below to a website. And on there, we have some videos where Leslie Keith, who's done a lot of research on this and published some great books. I recommend her book, The Lymphatic Code, if you want to learn more about this. But there's a nice video on the website there where she goes over research, where she shows results from the program that she's running and that I'm running. And if you're watching this video before January 31st of 2022, you still have a chance to sign up on an online course where we take participants through a program specifically designed for lymphedema and obesity to lose weight and to improve the lymphatic system. It's the same program that we have used for years in the clinics and have fantastic results with them. And if it is after January 31st, click on the link and see, we may have more stuff coming up. So thank you for watching. I hope that was helpful. As always check with your doctor first. I am not your doctor. You could have swelling because of heart problems and other serious things. So it's good to check on it. If you have sudden swelling in your legs, I highly recommend to go to your doctor and figure out what it is first. If the swelling is what we call peripheral, where the problem is not because of heart and kidneys, that's when we can look at the lymphatic system. All right, I hope you enjoyed that video. Please subscribe. There's probably more videos. My specialty is swelling and obesity. So those are the topics on my videos. And check out the link below for our website.